when I first heard about inflammation about 10, 20 years ago, it was like I didn't believe it, but now I learned a lot about that. So Didi's put together a wonderful presentation. So let's hear about inflammation and how it affects your health.
Yes, like Dr. Curnew said, today we'll be talking all about inflammation. Inflammation is kind of the foundation of a lot of different conditions and diseases, so that's why we think it's important to just do a brief discussion on that. So for today, what we'll look at is just an introduction to inflammation, so just a basic understanding, inflammation from a cardiology perspective, so how does it actually relate to the heart or heart disease, some signs of inflammation, so how can you actually check for inflammation, the influence of the diet on inflammation, and finally just some next steps. So where do we go from here after our discussions today?
So a little bit before we get into the discussion of inflammation, we just want to direct your attention to something that we're currently doing at the clinic. So the Canadian Red Cross is currently raising funds in donation to support the people of Ukraine for various humanitarian needs as they arise, both people in Ukraine as well as the surrounding countries. So we want to direct your attention to one of the links in which you can donate directly to the Canadian Red Cross if this is something that is of interest to you. You can donate 75, 150, 200, or whatever you're able to. And specifically, they've currently raised over $10 million, matching what the government of Canada has donated. So we provided the hyperlink on the slide, and we've also included it in the description of today's video, if that's something you'd like to check out. We also have a specific thing that we're doing at the clinic, which I'll discuss on the next slide. So as many of you are aware, Dr. Curnew does have a book called 30 Days to a Healthier You. And in this book, it's really all just about getting you healthier. It's written by many volunteers, as well as Dr. Curnew, to help you along your journey of leading an enjoyable, healthier lifestyle that's catered specifically to you. All of the funds over the years have gone towards good causes, such as various charities or for hosting programs for people in various communities. And currently, every $30 donation that you provide is going to be going towards the Canadian Red Cross to support the people of Ukraine. And so if this is something that you'd like to invest in, and you'd like a book to help support your health as well as contribute to a relevant and timely cause, there's some different ways in which you can connect with us. You can send us an email at drcurnew232@gmail.com with your phone number and a time you'd like us to call. That way we can book a follow-up appointment for you so that you can pick up your book. Or you can call the office directly. We've listed the number there to book a follow-up appointment with us in the clinic to pick up a book. Dr. Curnew?
And for a time, if you get a book and you try 30 Days to a Healthier You and you complete 30 days, I'll donate another $30 to the Red Cross at this stage. So basically, what I hope to do is decrease your inflammation tonight. And that's basically for many of us is losing a little bit of weight. So, right now, this is a tough situation. And basically getting yourself healthy is a good idea, getting other people healthy and helping others. So basically think about how we can all make a difference. And I wish I can say more about this, but this is what we're going to do right now. So basically you buy a book for $30, that money goes to the Red Cross. You're healthy for 30 days, another $30 goes to the Red Cross. If you complete a form or one of those things and just report back to us. How's that sound?
Sounds good.
Fire away. Let's learn more about heart disease and health.
Yes, just starting off with a brief introduction. So what is inflammation? Why is it a concern? And then just some common inflammatory diseases. So inflammation, we associate it with something that we think is bad, but it's actually a very natural immune response that we have in our body. It's the body's response to protect ourselves from harm. So in the context of immunity, when you detect something that's either foreign, the body considers it to be harmful, it can mount an immune response, which often is an inflammatory response, in order to kind of clear that pathogen, that infection, whatever that matter might be. The thing with inflammation is it can be acute or chronic. So it can be long-term in the case of chronic, or it can be for a particular period in the case of acute. And inflammation in general can be essential to the immune response. However, it can also be an unwanted and destructive process. So just to briefly distinguish between acute and chronic inflammation, on the left, we have some common causes of acute inflammation. So things like a chemical irritant. So perhaps you used a cream that you didn't like and it left you with a skin rash. That's a form of acute inflammation. An allergic reaction, infection, trauma, injury, burns, lacerations, cuts or wounds, frostbite, a general infection that can cause acute inflammation as well. In terms of chronic inflammation, that's what occurs when inflammation lasts well beyond the time that the harm actually exists. So say you're exposed to something that your body considers harmful, they mount an immune response, you have some acute inflammation, maybe that lasts like 2 to 3 days, but then you notice that the inflammation continues to persist even though the harm is no longer there. And chronic inflammation can be really dangerous because it does increase your risk over time for a variety of different diseases, ranging from cardiovascular disease, neurological disease, autoimmune diseases, things like rheumatoid arthritis. Can also increase your risk for cancer, fibromyalgia, chronic fatigue syndrome, etc. So in general, acute inflammation can be helpful to kind of address a cause directly, but chronic inflammation is not necessarily something you would want.
So one of the things, if you just backtrack a little bit, you can see that acute inflammation is good, repairs injury. Chronic inflammation can be detrimental. And so for many, right now, I'm decreasing my inflammation by having a plant-based soup. And we're going to talk a little bit more about that with some nice spices added to that mixture. And we're going to learn about that in a few minutes. The best way that people can reduce inflammation, if you're overweight, best body mass index 2025 is to lower weight. Second way is exercise, and is two things you can do on your own. Now, we'll talk about other strategies from medications and how to maximize diet as well. But this is important. Inflammation is a root cause for many chronic diseases, from arthritis to rheumatoid arthritis to cancer, heart disease, stroke, and Alzheimer's disease. So this is important. And so let's learn how we put a dent in this.
Yeah, so just to briefly give a little more context for these types of inflammation, as we discussed, acute inflammation commonly will occur during infection or something harmful entering the body, like we can see in this diagram here. So your immune cells will detect this. They secrete some inflammatory molecules to kind of control what's going on and cause that local inflammation. And this is really critical because while inflammation can be toxic, you need this in order to clear the pathogen or the harm. So again, as we've discussed, kind of helpful. There are some cases where it can go haywire. These are cases that we will commonly see in infectious diseases. So inflammation and immune cells go a little too far in their kind of secretory activities, and your inflammation will then become systemic. This can be toxic. It can cause tissue damage. It can lead to shock, which is fatal. And this is broadly called immunopathology when the immune system goes too far. But typically what will happen is something called a cytokine storm. I just bring this up because a cytokine storm, immune system going too far, it's things we see with diseases. So just to bring like COVID into context for a second, people like to talk about how COVID can be kind of a mild disease. It doesn't necessarily cause a whole bunch of death or a whole bunch of issues. However, even if the disease is mild, if your immune system overreacts, this is what can happen, and this can actually be fatal. So though acute inflammation generally is beneficial for the clearance of pathogens, it's important to recognize that it can go too far and to not kind of take diseases in your body's ability to clear diseases on its own too lightly, because there is a line that can be crossed in terms of clearing the pathogen versus damaging your tissues. Okay, so now to just briefly talk about the signs of acute inflammation. So these are the classic signs. You'll notice it feels red. There's heat, pain, swelling, loss of function. These are the 5 cardinal signs of acute inflammation. So chronic inflammation, on the other hand, occurs when the inflammatory response, as I mentioned, is sustained despite there being no direct harm. So the inflammatory mechanisms of the immune cells continue to stay activated and sustained, and they can go on to attack the body's own tissues. And this is when it kind of trends towards autoimmunity. So the immune processes can essentially go unregulated, and chronic inflammation doesn't necessarily always present with symptoms, but constant low-grade chronic inflammation can also increase your risk for a variety of diseases. So It might not be as pressing or as noticeable as acute inflammation. However, over time, it does cause a variety of different effects. So we talked about how that chronic inflammation over time can mean that your body actually attacks itself. This is something called autoimmunity. So your body doesn't really distinguish that it doesn't distinguish between itself and other harmful agents, and as a result, it can direct some of its abilities to clear what you would consider to be a foreign body or a pathogen from the body towards the body's own tissues. So common examples of autoimmune diseases are things like rheumatoid arthritis, lupus, multiple sclerosis, Hashimoto's thyroiditis. So these are all cases where the body is attacking its own tissues. In this case, could be specific organs or specific tissue types. So in terms of signs of chronic inflammation, though chronic inflammation itself may not necessarily be symptomatic, over time it can lead to a variety of different signs and symptoms that people might notice. So for instance, abdominal pain, chest pain, fatigue, fever, joint pain, mouth sores, skin rash, body pain, myalgia, gastrointestinal symptoms. So you can notice in terms of how you feel, things that you're eating that are either making you feel bloated or constipated, etc. Weight gain and loss, frequent infections, and depression and anxiety are all signs of chronic inflammation. So over time, you can see it does lead to some signs and symptoms that are not necessarily very pleasant, especially because they can happen on a daily basis. And this can kind of impact the quality of life overall as well.
So what's interesting is that you can see inflammation crosses many diseases. It's not also saying that every disease is caused by inflammation, and inflammation can play a role or a partial role in some diseases, a bigger role in others, and no inflammation in other diseases as well. So it's just a new avenue of treatment and investigation, and that's really burdened, or really we've discovered that quite a bit of change over the last 10 years in this area. So that's something when I started medical school, it wasn't there. Then it became a thing to talk about where we had no proof, and it went away. Now it's here. Now we know about it. It is a real problem, and we're going to explain how we can use it to your advantage to be healthier.
Yeah, so there are risk factors associated with chronic inflammation. So age, as you age, there's kind of an uptick in some of those inflammatory markers that contribute to chronic inflammation. Weight also adds to it. So excessive weight, having a BMI over a certain value can lead to more chronic inflammation. Additionally, diet can play a role, and we'll talk more specifically about that later on in the presentation. Smoking also plays a role in inducing chronic inflammation. Additionally, low sex hormones or fluctuating sex hormones can be associated with inflammation as well. And finally, stress and sleep disorders are also associated with chronic inflammation. So beyond thinking about kind of, your age, weight, diet, exercise, etc., you also have to think about stress levels and sleep disorders, as a sustained poor sleep hygiene or sustained chronic stress can also lead to chronic inflammation. And as we can see from the graphic on the right, the chronic inflammation that could be caused by any of these risk factors can then lead to disease later on.
One of the important things for most people, if you have a big belly, you have inflammation. And that's actually because your abdominal cavity is full of inflammatory cytokines that we'll show you in a few minutes from now. But inflammation, big tummy is a big problem, where being overweight the thighs area and the legs are less cause of inflammation. So that where your abdominal, if you have abdominal fat, if your stomach arrives before you do, you have inflammation, high inflammation, and do something about it. Sometimes it's very hard to do, but something that we can do something about, and we'll keep working that area. Thank you. Go ahead there, Dee.
Yeah, so there are several diseases associated with chronic inflammation, and these span various organs and organ systems. It's not very much confined to just one thing. So Alzheimer's disease, asthma, cancer, heart disease, rheumatoid arthritis, ankylosing spondylitis, type 2 diabetes. These are all things that can be caused by chronic inflammation. And some of the things that you would come to the clinic and we'd express concern over are things like heart disease and type 2 diabetes, and we can see there's a clear link between chronic inflammation and these diseases. So moving on to more of a cardiology perspective, so let's talk about the heart and the vessels. So inflammation and heart disease, well, plaque buildup and plaque formation is actually kind of an inflammatory process. There are inflammatory and immune cells and mechanisms involved in this process. So plaque buildup in general is perceived as abnormal and foreign. So when you think about immunity, if you think about an infection, the body recognizing a pathogen as foreign and then mounting this response in order to get rid of it, it does the same thing with other sorts of objects. So for instance, the plaque buildup, it perceives this as abnormal and foreign. It sets off a response because it doesn't want the plaque to be there. And usually the response is to try and wall off the contents. But as a result of trying to wall off the contents, it can actually cause plaque rupture. And this can be implicated in things like a myocardial infarction, atherosclerotic cardiovascular disease. Dr. Curnew, is there anything you'd like to add?
No, I think you summarized it very well.
Okay, so now to dive more into atherosclerosis. So this is just a buildup of plaque in the arterial walls, but what's important to note is that it's characterized by chronic low-grade inflammation. So if we take a look at this image on the right here, we can see that depending on like the inflammatory marker ratio, you get like a necrotic lipid core and kind of this growth of the plaque, whereas in the absence of that, it kind of isn't exactly there. So we can see like the progression of atherosclerosis is kind of dependent on these immune cells and these inflammatory markers. So if we're going to briefly look at kind of like the pathogenesis of atherosclerosis, I think my images are in the wrong order in the slide, but essentially you've got your you've got your LDL floating around in your blood. It gets into this layer right here, it becomes oxidized, and as a result, it actually triggers an immune response. So you get your monocytes, which are an important innate immune cell, coming to the endothelium. They kind of get in, they engulf that oxidized LDL, they become foam cells. So that's what happens when the macrophages take in that oxidized LDL, and then they kind of burst, and that's what releases a whole bunch of stuff. So we can see that even in the early stages, you know, you just have high cholesterol, it's contributing to plaque formation. You're actually recruiting immune cells to help deal with this. And as a result, inflammation is kind of at the core of some of these processes, especially in the pathogenesis of atherosclerosis.
So this is actually a very interesting slide. If Fastu, you can put an arrow on top there that you can see that the first layer is the endothelia. That's one cell thickness. Above that is your bloodstream. Below this is all the vessels. Just backtrack one slide here. If you go one slide backwards, is that okay, Dee Dee, there?
Yeah.
This, what you're seeing here is if you can just point the endothelial, Stuart, on one of those slides here, that's basically blood is in contact with that one single layer. It's a very delicate layer. And you can see when it gets disrupted, you get these inflammation cells, and it causes a war. You see that necrotic lipid core. That's the vessel wall being attacked by these cells that penetrate, and your body's trying to deal. It doesn't like to have cholesterol in that territory, and it brings inflammatory cells, and it causes a battlefield. And so this is the atherosclerosis, or the inflammation of vessel walls. Next slide, please. So again, when you look at the atherosclerotic process, is that endothelial needs to be kept healthy, and you can damage it by blood pressure, cholesterol, smoking, diabetes, infections, and you can see how that gets disrupted, and this triggers this process. So next slide, please. So very important. So this is just amazing. Go ahead, tell us what's happening next there, Dee Dee.
Yeah, so eventually you get the plaque formation, it could rupture, etc. But in diving more deeply into inflammation in atherosclerosis, so we talked about how the LDL gets in, it gets oxidized, and you also have this recruitment of this monocyte that turns into a macrophage. It engulfs the oxidized LDL, becomes a foam cell. But in that explosion of that foam cell, when it kind of dies and releases all of its contents, it releases a bunch of pro-inflammatory cytokines. Now, macrophages themselves are key immune cells when it comes to secreting all of these inflammatory molecules. They're kind of the best at it. They secrete so many of them. And as a result, you kind of get this release of these pro-inflammatory molecules, so molecules that cause inflammation. So you'll see the terms like interleukin, 1 beta, TNF alpha come a bunch, but just so you know, they're kind of inflammatory markers. And what happens when this is released is it actually promotes further inflammation. So it gets kind of more of these immune cells to the site of the endothelium. they kind of do more of their job, they cause more inflammation. So it kind of initiates this cycle. So even if it's like just a couple of these monocytes or macrophages coming to the site and then kind of doing this process and forming these foam cells, it initiates the cycle and it continues and continues to happen as you have kind of one thing being triggered by the LDL that triggers more inflammation, triggers more engulfing of the oxidized LDL, triggers more inflammation. So it's a very cyclical process.
So this is actually a very interesting slide. So again, we're in the blood vessel, that red part, you see LDL, lousy cholesterol, and people say, how low should my LDL cholesterol be? As low as you possibly can. We have this rule 311, total cholesterol less than 3, HDL greater than 1, triglycerides less than 2, LDL less than 1. You don't need LDL cholesterol. LDL is damaging to vessel walls. All your cells make their own cholesterol except for mature red cells. And you want that endothelial load to be healthy. And that's, you don't want damage by smoking, by blood pressure. You don't want to lose the elasticity of those vessels, so regular exercise. And you can see to help promote this cascade or help stop this cascade, lower LDL cholesterol and lower and protect your endothelium, so make it less permeable for this to happen. Because once this cascade goes, it explodes and it can just amplify, as you point out very nicely. So preventing that from happening is very important. Now, saying that you can block it in many areas and just blocking one pathway, my hope is that if I get cholesterol up to 0, that heart disease goes away. It doesn't go away, but you could actually get rid of a lot of heart disease by getting LDL cholesterol down. For every 1 millimole reduction of LDL cholesterol, vascular disease falls by 20%. So if your LDL cholesterol is 4 and you reduce it down to 1, you lower your risk of heart disease by 60%. If your LDL cholesterol is 2, you lower it down to 1, you lower your risk by 20%. So these are important any factors. And so there's no threshold here. It's just more is better when it comes to LDL cholesterol. Now you need inflammation too, because when you have an injury to arteries, it needs to repair itself. And if you have like viruses or bacteria, then you don't want them to multiply. You need your inflammatory system to actually get rid of the virus and the bacteria, but you don't want it to be overactive. Beautiful slide. Next slide, please. Thanks for showing that, Dee.
Yeah, so essentially just to summarize what we've discussed, those macrophages that are involved in the plaque formation are inflammatory cells. And when the foam cells burst, they do release those pro-inflammatory cytokines, recruits more cells, it kind of sets off that cascade. And inflammation in general can also make that endothelial border, that barrier, more leaky as well. So you can kind of get more things kind of moving into those layers beneath. So inflammation is kind of at the core of forming the plaques, and you can trigger a lot of downstream cardiovascular events. So as a result, though inflammation can be good in senses if we want to clear infection, we want to clear pathogens, when it's occurring in instances that it doesn't necessarily need to be happening in, it can cause kind of downstream effects. So aside from cardiovascular disease, atherosclerosis, there's also an association of inflammation with stroke. So atherosclerosis, we commonly think about these plaques forming in the coronary arteries of the heart, but they can technically form anywhere, including in arteries in your neck, etc. So from this diagram here, we can see that autoimmune diseases and infectious diseases can lead to a lot of different stroke risk factors. They can cause neurovascular inflammation, they can cause general inflammation, and the combination of these two kind of factors can multiply the risk of strokes. So inflammatory diseases in general, because there's a higher level of inflammation and inflammatory markers circulating around in your body, can increase the risk of stroke. So again, kind of signifying that chronic inflammation can have a lot of potential deleterious effects. And I will pass it off to Dr. Curnew for this slide.
Sorry, for when I started this pathway, I just thought just lowering LDL cholesterol, and you get a lot of benefit by lowering LDL cholesterol. We talked about for every 1 unit or millimole reduction in LDL cholesterol, vascular events fall by 20%. But we have other things too. We talked about diabetes, high blood pressure, Lp(a), triglycerides, and now inflammation are all playing a role. For instance, now we have to worry about triglyceride remnant particles. Right now, there's something called Lp(a). This is a new marker. Well, this is actually a marker that's been around. It's a genetic factor present in 20 to 30% of us. That increases risk of heart disease 2 to 4-fold. We know that blood pressure damages vessels. For a 10 millimeters reduction of blood pressure to around 110 to 120 systolic, vascular events, heart disease can fall by about 20% for having a heart attack, stroke by 30%, it can justify it by 30%. And we're now exploring that inflammation plays a huge role in this area. For diabetes, the best way to treat diabetes is to put in remission. So people being a type 2 diabetic for less than 5 years, you can probably put it into remission if you're overweight by losing 30 pounds and keeping it off in 70% of the time. So these are factors that you can do. And by lowering your weight, you're decreasing inflammation as well. So you're lowering the blood sugar, but you're also lowering markers of inflammation as well. We'll talk about that. Next slide, please. So this is actually very, very important. And the first trial that so you can certainly do diet and lifestyle changes, lowering weight, and that's the cornerstone. I will never say that, never change that. Smoking damages vessels. Every time you smoke, you lose 5 minutes of life, and it causes inflammation. This is a trial using drug therapy called colchicine. Colchicine is a drug that's been used in different inflammatory processes. It's used in something like called pericarditis, for instance. It's used in many rheumatological disorders. Colchicine 0.5 milligrams a day lowers the risk of heart disease here by about 30% or so. There are 2 good trials so far that demonstrate in people who just had a heart attack or chronic stable disease that colchicine can be useful in this circumstance. So you're going to see more and more physicians use that. Instead of proceeding to colchicine, why not try to use a natural approach too as well in combination about losing weight, diet, and exercise we'll talk about. Next slide, please. So here's proof of concept. And again, this is a slide that talked about inflammation. On the far right was a trial called CANTOS. CANTOS was one of these cytokines that was utilized and shows reduction in cardiovascular events as well. A 15% reduction in heart attacks and strokes. It also lowers something called C-reactive protein by 39%, which is a marker of inflammation that we'll talk about right now. So we have proof of concept in developmental clinical trials showing that lowering inflammation with drug therapy works. Here is using an expensive drug that's one of the inflammatory processes. We have data with colchicine in 2 other trials as well. You can see there's multiple inflammatory cells on your far left, multiple targets of therapy to think about in this area. Next slide, please. So these are things that have been shown to be of value. If you go to your far right there, students, you can put this plaque over there, this plaque buildup. Is that, the far right you can see is that's an atherosclerotic plaque. And people say, you know what, you're having a heart attack, you have a ruptured plaque, or you have angina, you go for an angioplasty, and you say thank you so much to the wonderful people at the hospital. Yeah, that's a therapy. But go to the left when you have this inflammation at its core belief here. Why don't you just stop the inflammation from happening in the first place? And so, by lowering your cholesterol, lowering your weight, lowering your blood pressure, not smoking, trying to get into a better weight, a better diet, better blood pressure control, you prevent this problem from happening in the first place. Holy cow, why do we have to wait till you have a heart attack or stroke and then you say, thank you so much for saving my life? Why don't you save your life today? Because 80% of cardiovascular events are preventable. And there's multiple steps to look at that. So, and certainly inflammation and giving a drug like colchicine or using a powerful immunosuppressant agent certainly shows some value. It's a small benefit, but it's a real benefit, but they have potential. By suppress my immune system, I may actually trigger infectious processes. So that's why is that people that are taking immune suppressive agents are more prone to infectious complications such as COVID, pneumococcal pneumonia, influenza. They have to watch themselves more carefully for infection. And colchicine also increases the risk of infection slightly as well. Next slide, please. So these are things to think about. Again, you can see on the left, here's a simple vaccine. In the initial trials with the vaccine decreased severity of disease by 90%, including hospitalization or deaths. Or you can get sick and go in the hospital and get all these other drugs and treat the disease later on in its core. Now, the mistake that healthcare people have provided is that the story behind vaccines has been around for 20 or 30 years. The iron lung's gone away, polio's gone away, tetanus is a disease of the past if you have proper immunizations. Different diseases respond differently to immunosuppressants. And so the science is quite good. The vaccines are very effective. What's sad is that we as healthcare providers, if all the scientists give you information, we think people will change their behavior. The answer is not true. We should have got more press people, more politicians on board. We should have got Hollywood involved to make better films about COVID, and you would have been more convinced. So the science is good. What happened to the virus has mutated, and immunity is not long lasting at this point in time. But you know what? The science are catching up, and they've done a lot of good right now. Next slide, please. So what I've done this year is got all my immunizations. This is a wonderful app that you should get. This is just happens immunization for kids. Do our kids get great immunization. I had recurrent ear infections growing up. I was always at the doctor's office. I was always getting antibiotics, and I got my tonsils taken out. You know what? That disease is gone. You know why? Because pneumococcal pneumonia was a bacteria that got into your nose, got into your ears, into your throat, and caused recurrent ear problems, otitis media. It also caused tonsillitis. And basically, by being immunized, that disease has gone away. And so instead of getting my tonsils taken out, I should have got Prevnar 13. And now, as adults, as we get older, we need Prevnar 13, other vaccines such as influenza, shingles. Just getting shingles increases your risk of heart attack. Getting influenza increases your risk of heart attack. COVID increases. So, if you have COVID, your brain shrinks. You're going to probably have more Alzheimer's disease. If you have any COVID infection, there's probably about 80% in some degree of inflammation to the heart. The more severe, the more takes place. If you get shingles, you have more heart attacks. And we know that people who had COVID in the next year, this is data from the VA hospital system, over 150,000 people, you have more heart attacks, more strokes, more blood clots, and more, so it just causes more inflammation. And so get your vaccines in order. And so that's what I did this year. Next slide, please. So this is a way of decreasing inflammation. So I'm not saying it's a sole route, but it's one important rule to think about. And we have a bunch of videos about that to do that. Aditi taught me a lot about this. Now let's look at some of the signs of inflammation. Take it away there, Aditi.
Yes, so there are some things that you can do to actually screen for inflammation. So you can get a blood test to kind of look at some of these inflammatory markers. So the one we'll be talking about today is CRP, or C-reactive protein. That's a common one that you can get a blood test for. Depending on what conditions you might be being screened for, you can also get blood tests for other inflammatory markers. So you can get an ESR, or sometimes for autoimmune diseases, or when they're screening for certain inflammatory disorders, they can order kind of specific inflammatory markers. They're not available on necessarily standard blood tests, but depending on what you might be getting screened for, it's something that your physician can order. So we'll talk about CRP today, but just to kind of highlight the fact that in terms of inflammation, you can see a lot of evidence of this in the blood based on what is circulating, and as a result, blood tests can be used as a way to kind of figure out what's going on.
So physicians are allowed to measure CRP at this point in time. Only certain physicians are allowed to measure ESR and other parameters. I'm not allowed to measure ESR. That's more like a rheumatological disorder, and so things like temporal arteritis. But CRP is something that's readily available, and that can be ordered if necessary. Now, if you get a cold, you get sick, CRP goes up. So I don't really care so much about acute infections for most people. I'm looking for chronic infections. So if you want CRP to be measured to look for signs of inflammation, you should probably be 1 or at least 2 months after you've been hospitalized or sick to get a steady state for chronic inflammation, as you point out there. Thanks a lot, Dee. Tell us more.
Yeah, so CRP is a protein that's produced by your liver in response to infection of an inflammatory disease. So it's an early indicator of systemic inflammation. So normal CRP, this is kind of debated because they say it should be less than 3 milligrams per liter. However, you'll notice that the reference ranges can tend to vary from when you actually get the CRP measured. And that's partially because values of CRP can differ between ages, gender, ethnicity, time of the day. Like Dr. Curnew mentioned, if you have an infection, it goes up. So depending on when you get it measured, it can kind of be susceptible to being different. But in general, we would like to say that normal CRP should be less than 3. So this study here is looking at the percent of cardiovascular events in 3 different groups with CRP. So we've got the low risk group down here, which is T1, the higher risk group is T2, and the highest risk group is T3. And we can see in the group that has the highest risk, so the most kind of chronic inflammation as they've measured with CRP, has the highest percentage of the cardiovascular events over the years of follow-up. So that just kind of illustrates that there is a direct correlation between CRP, which is this inflammatory marker, and the incidence of particular cardiovascular events. Thus, again, kind of showing that chronic inflammation or systemic inflammation can be implicated in cardiovascular pathology.
So Aditi, you have to tell me if I'm lowering my CRP tonight. So I'm trying to lower my CRP, and those who want to, after this webinar, I'm going to go down to the harbor, and it's Pier what, Stuart? Pier 6, Pier 9, Pier 3, what is
Pier
it?
8.
Pier 8, whatever. I was there last night. I'm going to go skating. So anybody want to come join to lower your CRP and inflammation, come down, join us afterwards. So after the webinar, I'm going to leave the office in about 15 minutes and go down there. And you can skate till 10 o'clock tonight. It's refrigerated ice. I've been skating every week, every night this week, because I know the ice is going to always be gone soon. So there you go. And by the way, if you're a really good skater, don't come with us. And if you're a really good hockey player, the Toronto Maple Leafs need a really good goalie at this point in time. So go out, try out for Leafs if you can, and that will lower your CRP too as well. Go ahead. Actually, we'll actually acutely rise your CRP because you get hit by the puck 100 miles an hour. That will cause a lot of a big bruise or a lot of inflammation in there. But you'll lose the weight and be very active, and you'll run away from the puck and you'll lose some weight in that way. Let's hear about how diet can lower your CRP as well.
Yes, so a diet can be one contributing factor to inflammation. It's also something you can modulate to help regulate inflammation. So before we talk about more of the inflammatory processes, just a brief discussion on diet and COVID. So we know that COVID can cause pretty significant inflammation, and something that we've kind of been curious about is whether diet can actually have an impact on the severity of COVID-19 disease that you face. So they did a prospective cohort study in 2021 on whether diet quality was associated with the risk or the severity of COVID-19. So they had 592,571 participants, and they used a healthful plant-based diet score in order to assess the diet quality. And they found that a diet that was full of healthy plant-based foods was associated with a lower risk of severity of COVID-19. So essentially how they conducted the study is they had people use this app for reporting symptoms. And they kind of looked at anyone who got COVID as part of this cohort and what symptoms they reported. And they used that to kind of assess the severity of COVID-19. And they found in general, based on like the index score that people had in terms of rating their diet, they found that people who generally rated their diet as healthier and achieved a more healthful plant-based diet score often had less severe symptoms, less severe COVID-19.
Just backtrack one slide. So it's an interesting set. There's a series of data saying that if the healthier your diet, the less infectious processes you get, less cancer, less heart disease. But it also showed that the strongest observation, those were the most plant-based eaters had the most protection. Those that were fish eaters or somewhere in between, and those who ate the most meat, meat was actually contributing to inflammation. So, you know, I'm not saying diet is enough to cure COVID or any infection. The answer is no, but it does play a role. And what I hope to point out to people, everything plays a role. It's like we talk about the Toronto Maple Leafs. It's a full team. You can't have one superstar. You know, Toronto Maple Leafs have 3 superstars, but that's not good enough. You need the whole full team to work well to this. And diet certainly plays a bigger role than most people think about. Tell us more.
Yeah, so Dr. Curnew, I think this is your slide if you would like to.
Yeah, so this is actually, Aditi does these wonderful cooking sessions, and this is actually on Super Bowl Sunday, so we usually do those usually between 4 and 6 o'clock. And we were making a Super Bowl snack, and basically these were cauliflower wings, and they were so good. So instead of having chicken wings for the Super Bowl, we had cauliflower wings, and we used quite a bit of spices, which is has a lot of anti-inflammatory properties, and we have this new convection oven. Notice I'm not allowed to use that oven. This is something that my wife and daughter have banned me from. Apparently, I break things, and so Jenna, my daughter, that day actually made these wonderful cauliflower wings, and they didn't last very long. They were delicious. I was really surprised how good they were, and I hope she's actually coming back from school this weekend. I hope she'll let us make some more. You can see the background. She loves that orange crush of hers. So that orange crush drink back there is pro-inflammatory, but the cauliflower wings are anti-inflammatory. So tell us more how we can eat better and be healthier and have fun.
Yeah, so there is a direct correlation between diet and systemic inflammation. So if we briefly look at omega-3s versus omega-6s, so omega-3s, things that you'll find in flaxseed, chia seed, fatty fish, they are anti-inflammatory. So they kind of produce these compounds that are anti-inflammatory. They reduce the amount of oxidative stress, and as a result, they can reduce inflammation. Omega-6s, on the other hand, things that you might find in meat, corn oil, etc., they can produce arachidonic acid, which is a precursor to prostaglandins, which they are inflammatory in nature. They can essentially cause like a bunch of contractions. They can cause a bunch of inflammation. So we can kind of see that on two ends, a source of one omega-3 is really great in terms of anti-inflammatory properties. We can see on the other end of the spectrum, when we look at omega-6s, they're a little more inflammatory. So what we eat does definitely contribute to inflammation overall, and we'll discuss this a little more in, I think, the next slide. So the gut is definitely related to inflammation. You have a microbiome in your gut, and what you eat is really important, kind of nurturing that gut microbiome. And that in turn can dictate a lot of inflammatory processes within your body. So diets that are high in salt and saturated fat feed the pro-inflammatory bacteria and induce the expression of pro-inflammatory T cells, which are a type of immune cell. And if you eat a diet that's rich in fiber, antioxidants, and anti-inflammatory properties, that's associated with the anti-inflammatory expression of those immune cells. So immune cells have the ability to go both ways. Depending on what you eat, it can kind of push it towards the pro-inflammatory side, or it could push it towards the anti-inflammatory side. So there is a definite relationship between what we're eating and how it affects the expression of different things in the gut that's related to kind of systemic inflammation. So just going a little more briefly into diet and inflammation. So the Western type diets, the diet that's kind of typical to North America, is typically one that is higher in fat, and as a result can overexpress this LPS gram-negative bacteria. It basically overexpresses a type of bacteria that can lead to a lot of inflammatory signaling. And as a result, it increases your risk of adiposity, which is when you have like the accumulation of fat around your belly. That would be central adiposity, inflammation, insulin resistance, and gut permeability. So we can see the fact that these types of diets are high in fat has a direct impact on the regulatory mechanisms in the microbiome in our body. And as a result, we get this increased risk of all of these other things that could potentially happen. Because it's low in greens, we're not really feeding the good bacteria in our gut. Because it's low in fiber, we're also not feeding the good bacteria in our gut, and that affects the regulatory functions of some of these cells that can kind of regulate inflammation and keep it in check. And finally, because the diet tends to be high in fat, high in salt, it can affect the concentration of the different types of bacteria in your gut. So it can change the expression to kind of favor one that's a little more inflammatory over another. And as a result, the downstream effect is that it will affect the immune cells that you have as part of like your mucosal immunity, which does exist within your gut, meaning that you get more inflammation and less anti-inflammatory stuff. So there is a direct relationship between what you eat and the inflammatory outcome. And essentially what this kind of diagram points out is that you don't want to be eating a diet that's super rich in one thing and then deficient in everything else. It's kind of all about balance, and you really want to be focusing on the greens and the fiber. Okay, so foods that cause inflammation, well, typically highly processed, high in salt, high in saturated fats. They will upregulate those inflammatory mechanisms, and this can cause inflammation that can be quite systemic and chronic. So things like French fries, canned soda, red and processed meat. Um, Gluten kind of depends. If you're not necessarily gluten intolerant, you probably don't have to avoid this. And again, with dairy, again, if you're not necessarily intolerant, you don't have to avoid it per se, but just kind of in moderation. So on the other end of the spectrum, we have anti-inflammatory foods, so foods that help fight inflammation. So in general, plants tend to be a really great source of anti-inflammatory properties. And this is because fruits and vegetables have compounds such as phenols and triterpenoids, which are shown to have high inflammatory activity. They're also great sources of fiber. So for instance, some anti-inflammatory foods include things like tomatoes, olive oil, leafy greens, nuts, fatty fish, and then fiber-rich fruits and vegetables.
So it's interesting for me is that olive oil, if you're going to have olive oil, you want, first press extra virgin cold pressed olive oil that has the richest amounts. The more you process it, and olive oil is processed, it's also rich in calories. So what I try to do is eat a few olives. But I really I'm trying to avoid all the oils as much as I can because I'm just always hungry and calories are calories. But I try to incorporate a lot of these foods. I love nuts. I try to have just small amounts of them. And thank you. Keep telling us more.
Yes, so soy is another thing that's found to be anti-inflammatory. So a 2012 study found that the consumption of soy foods was associated with a lower level of interleukin-6. This is an inflammatory marker. It's an inflammatory cytokine that's released by your various immune cells. So the fact that it was reduced kind of indicates lower inflammation. So tofu itself contains a lot of anti-inflammatory and antioxidant properties, and it also has some phytochemical properties. So it's a great source of kind of fiber and protein if you're looking to go in a more plant-based direction. It has shown in previous studies that it does, in fact, kind of is associated with lower inflammatory markers.
Now I just use just straight soybeans and I soak them, then I boil them up and I put them into my foods and things of that nature as well. And there's actually, by the way, a recent study that showed that women going through their menopause having I think I'm not sure it was a half a cup or 1 cup of soybeans per day on top of predominantly plant-based eating decreased hot flushes, severity of hot flushes, and it was actually a very powerful way of decreasing hot flushes in women going through menopause. And there's actually data that adding beans because of the fiber, the nutrient content makes you feel full, and you'll lose some weight too as well. So lots of ways of being healthier.
So a common misconception is that if you have to add flavor, you have to use like a lot of sauces, a lot of salt, things that could be higher in calories, could be higher in sodium, could be potentially causing some inflammatory effects. But there are plenty of ways to add a lot of flavor while packing in those anti-inflammatory ingredients. So for instance, things like onion, garlic, ginger, turmeric, cinnamon, cloves, black pepper, cardamom, rosemary, lemongrass. All of these are really flavorful ingredients that you can add to any meal as the basis of any meal, and they also have a lot of anti-inflammatory properties. Turmeric especially is cited by a lot of different articles as having a wide variety of anti-inflammatory properties, and a lot of people will mention they take turmeric supplements in order to get those anti-inflammatory properties. You can simply just add it to basically any food that you eat, and you'll be able to kind of get the same benefits rather than having to kind of buy a supplement that you necessarily need to take. So these are some of the ways that you can add flavor to your food, so you're not taking away the flavor factor, but you're also packing in a lot of antioxidants and anti-inflammatory ingredients that can have great benefits for your body as well. Dr. Curnew, you're muted.
Sorry. Thank you so much. That may be a better thing for me to be muted, but you did a wonderful presentation on vitamins, minerals, and micronutrients. And what I take away from this is that Mother Nature knows that the combination, the cocktail, the recipe of health. When we give supplementations, we failed miserably most of the time. So And if taking supplements, just use real non-processed whole foods and just blend them all together, get that rainbow of colors. And if you like spiciness, add a lot of these ingredients to them. And we're still learning what the best, best cocktail combination is. And certainly Mother Nature has done a great job for centuries. You mentioned like the gut, we have, the gut is where most of our bacteria resides, and people saying lots of things, if I use this form of yogurt or this supplement or this lactobacilli, whatever, you'll do better. The answer is, we don't know. We do know the concept is good. And I just use Mother Nature and use whole, real, non-processed foods as much as I possibly can. So that's my recommendation to everybody, to use these spices. Different flavors. So, for instance, like I get this balsamic vinegar, and one of the things is that we can talk about, fermentation of food at some point in time that might have some properties as well. There's so many things to explore right now, but use real food.
Yes, so if we talk about the benefits of anti-inflammatory eating, well, not only is it reducing systemic inflammation, but eating more anti-inflammatory can also help people who have chronic inflammatory disorders manage some of their symptoms. So for instance, eating more anti-inflammatory foods is associated with better symptoms in terms of IBS and arthritis. Anti-inflammatory foods are also often a really great source of fiber, complex carbohydrates, healthy fats, and that in general, having a diet rich in that will help reduce blood sugar, cholesterol, and triglycerides. And it also will overall reduce the inflammatory markers in the blood, as long as this is kind of your consistent diet. And additionally, we talked about how a risk factor for inflammation can be like poor mood, stress, and sleep. It can also be a consequence of inflammation, that your sleep is impacted, your mood is impacted. And as a result, eating more anti-inflammatory foods has been shown to result in better mood and better sleep as well. And from a preventative perspective, if you're eating more anti-inflammatory foods, if you're helping kind of keep your systemic inflammation as low as you can, it can decrease the risk of excessive weight, heart disease, diabetes, depression, and cancer. So just talking specifically about some diet types that you could try. So whole food plant-based diet can be kind of an extreme jump for people, but we're just basically going to talk a little bit about the evidence today. So the biggest trial in support of a whole food plant-based diet is the BROAD trial, where participants were recruited and then they had an intervention phase where they were also receiving follow-ups, and then there was a control group. And essentially, they looked at the effect of a low-fat, plant-based diet on individuals who were overweight, had diabetes or ischemic heart disease or cardiovascular risk factors. And there was a reduction in BMI at 12 months of about 4.2 kilograms per meter squared, a reduction in cholesterol by 0.55 millimoles per liter at the 12th point, and there was also a reduction in hemoglobin A1C. So we mentioned earlier how inflammation can be related to weight. So excess weight can be a risk factor for inflammation. And additionally, an increase in LDL cholesterol, high HbA1c, indicating that you're not, you're kind of insulin resistant. These are all things that can be implicated in inflammatory processes, but when we look at the effect of the whole food plant-based diet, it seems to kind of reduce and kind of attenuate some of these different factors. So it can be a powerful diet from that perspective. So the next diet we're going to talk about is the Mediterranean diet. This is a really great diet because it's not quite as extreme as going completely plant-based, but what the diet does is really focuses on encouraging you to eat more plant-based foods while not necessarily limiting foods that aren't plant-based. For example, you are encouraged to eat moderate amounts of fatty fish. You are, however, recommended that you eat very little, or only on rare occasions you will consume things like saturated fats and red meat. So the main trial for the Mediterranean diet has been the PREDIMED trial, which was done in the Spanish cohort. So they found less cardiovascular events in the group on the Mediterranean diet compared to control, as we can see from the graph here. One of them is for extra virgin olive oil as the main source of fat. The other one is nuts as the main source of fat, and both of them had less cardiovascular events compared to control. Now, in some follow-up studies, they also found that the risk of myocardial infarction and stroke combined with CVD was about 28 to 31% lower in individuals who were on the Mediterranean diet. And they also found a reduction in your LDL cholesterol, blood pressure, CRP, which is that inflammatory marker we talked about earlier, as well as weight reduction with the Mediterranean diet. So you can see by kind of trending a little more plant-based, focusing more on fiber-rich foods, focusing more on your fruits, your vegetables, your grains, your beans, etc., you're kind of able to attenuate things from an inflammation standpoint by reducing your LDL cholesterol, reducing your weight, reducing some of your inflammatory markers, and in general, just kind of reducing the amount of systemic inflammation you might have.
So the principal reduction here was stroke, which is very important. Very interesting. They also analyzed by the more plant-based eating you did, the more the reduction in cardiovascular events took place too as well. So you can see how diet can influence what you're eating. Thanks for sharing that.
So then the question becomes, is whole food plant-based but better than Mediterranean? So there was an actual trial that was done in 2021, which is a randomized crossover trial to compare the two diets. So patients were on one diet for 16 weeks. They went back to their regular diet for a baseline of 4 weeks, and then they went on the opposite diet for 16 weeks. And they kind of compared different metrics to see if one diet was more effective than the other. And essentially, they found that the plant-based came out superior when it came to weight change, insulin resistance, insulin sensitivity, cholesterol, etc. Mediterranean was superior when it came to blood pressure control. So it does kind of show that the more plant-based you are, it is a little bit more effective in lowering weight, boosting insulin sensitivity, and then lowering your total cholesterol. Mediterranean diet is a bit better for blood pressure, but again, the point of discussing these diets is just to show you that the more kind of plant-based you're leaning, the better the results can be. That doesn't mean you need to go all the way. Doing something that's consistent and consistently including healthy meals, healthy alternatives is better in the long term than trying to try something for a very short period of time but not being able to stick to it.
I think the number one priority for many of us is that 70% of North American adults are overweight is weight control. And so if weight control is your primary target, you can see, Stuart can show this, is that the Mediterranean diet wasn't that great at weight reduction, but the plant-based diet was better at weight reduction. So that really points to is that the more plants, less processed food, the better off you are, and the more likely you to lose weight. There's more fiber. And if you look at the bottom, if your goal is to lower blood pressure, is that the Mediterranean diet has also, probably because it was rich in extra virgin olive oil and other antioxidant effects as well, is better at blood pressure lowering. Do you see? So it's not one diet is better than the other diet. It is that the more healthier the diet, the more you are. And for me right now is that my blood pressure is good. I'm struggling to keep that weight off. I want to use as many plants as I can. Now, on the other hand, if you're a skinny person and having extra virgin olive oil and olives in your diet is not a bad thing, and actually lowers your blood pressure better. So it has different effects. It's not that one diet is best for everything, but is to pick and choose how to adapt your diet and how to change your diet over time and try different things over time. So this is actually high quality randomized control data to show that. And I think that's a very powerful piece of information. So again, lowering blood pressure, Mediterranean diet is better, lowering weight, plants are better. Next slide, please. Thanks.
So this kind of brings up the question. We've talked a lot about diet and the way different components of diet can help with inflammation, but what about supplements? So if you Google kind of anti-inflammatory supplements, you'll get a whole bunch of hits from a whole bunch of different websites recommending that you eat adequate vitamin A, vitamin C, vitamin D, calcium, copper, and zinc, and they'll go one step further to suggest that you should probably be supplementing these. But the question we have to ask is, are dietary supplements first off safe? Because you're taking something in a more concentrated form than you might. That's kind of different if you're eating like a fruit that has a lot of vitamin C versus just taking a vitamin C capsule. And the second thing is, do they actually help reduce inflammation? Are they actually kind of beneficial overall? So this is a trial whose results should be coming out shortly. It's called the Cosmos-Mind trial, and they're looking at whether a multivitamin has an impact on cognitive decline. So essential nutrients, these like B12 and folate, have been linked to cognitive decline in previous studies. So there have been a few RCTs about these nutrients, RCTs being randomized control trials, but this trial in particular is a cohort of 2,262 individuals above the age of 65. They were all randomized to the vitamins or placebo group, and they essentially looked at cognitive assessments at baseline and then after taking the multivitamin to try and assess whether it had an impact. So they did find that the group that was randomized to the vitamins did better than the placebo group. There was also a subgroup with cardiac conditions who showed better benefits with the vitamins. There is a trial involving dark chocolate that's still ongoing, so we should be getting the results of that soon. Though it is important to note that in the case of this trial, there are stakeholders in the various industries participating, so you kind of have to take the results with a little bit of a grain of salt because you have people who are invested in the results actually investigating. So this trial in particular is showing that multivitamin may be a bit useful in terms of cognitive decline. However, some of the evidence is still a little bit mixed. Dr. Curnew, is there anything you would like to add?
Yeah, so vitamins and different supplements have been studied. So for instance, I saw a patient come to my office today in atrial fibrillation taking fish oil capsules. You know what? The fish oil capsules the person is taking doesn't do any help increases in atrial fibrillation by 30%. The only fish oil capsule that shows that a benefit is pure EPA pharmaceutical grade. So there's a lot of people taking vitamins. And we talked about at the beginning is that there's the science and then there's the marketing. For most of us, we're more influenced by marketing over science because most of us take a supplement. We want to feel that it's providing protection, but go back and look at the video that we did or Didi highlighted on minerals, supplements, vitamins, micronutrients. Mother Nature knows the algorithm. Mother Nature knows the code. When we try to figure out from Mother Nature, we got it wrong. We got it wrong for vitamin C. Beta carotene increases risk of lung cancer. And vitamin C does not prevent COVID. We had a whole series of studies with vitamin D not showing as much as we'd like it to. And so this is a positive trial, or said to be positive, but we'll have to see how positive it actually is. So I'm still going back is that I'm going to get my micronutrients and my antioxidants and from basically lifestyle changes, trying to keep my weight down, try to control all my risk factors. If you go back to the trial, if you go back one trial to cholesterol reduction, you just go back a little bit to the, I went back one more. If you look at this trial here, this is what you can achieve by plant-based eating this trial. You had a 0.4%, $4.4 million reduction of LDL cholesterol. I can lower your LDL cholesterol by 3 full points. Yes, you can lower blood pressure by diet and lifestyle change, but we have very good medications. Move forward back to the normal trial. So you have to use the best of lifestyle changes and pharmaceutical agents. And unfortunately is that most of the vitamins that we get, the supplements just don't work. And I'm hopeful this will work. And it'd be great if we can help delay Alzheimer's disease, but be cautious and try to figure out from science, from marketing. And unfortunately, most of us are persuaded more by good marketing over good science. Healthcare providers are taught to evaluate science. Listen to the people from the science to help make your decision as well. I hope you use more of a scientific approach than more of a marketing approach, but you have to decide what's right for you.
Yeah, so another thing that you would see if you kind of Googled vitamins and inflammation is a lot of people will recommend vitamin D and omega-3s. So there was this trial that was a large RCT, so randomized control trial of vitamin D and omega-3 supplements for primary prevention of cancer and cardiovascular disease. So it actually found that vitamin D did not reduce the incidence of invasive cancer or cardiovascular disease compared to placebo. So cancer was diagnosed in 1,617 participants in total. So 793 in the vitamin D group, 824 in placebo group. This was not a significant difference. 805 major cardiovascular events, 396 in vitamin D, 409 in placebo. Again, not a statistically significant difference. And then with the omega-3 fatty acids, they also did not reduce the incidence of invasive cancer or CVD compared to placebo. So again, 820 cases of cancer in omega-3 group and 797 in placebo, 805 major cardiovascular events, 386 versus 419. So again, not a statistically significant difference. And what we mean when we say not statistically significant means that the results could have been due to chance. They're not necessarily due to the intervention. And as a result, we can't say that it's significant.
So the VITAL trial was a trial of 25,000 people, well conducted, well follow up. And the year after, two other big trials showing that if you have a normal vitamin D level, taking vitamin D doesn't prevent cancer, doesn't prevent heart disease. It makes the person selling you the product rich, not you. What I learned too is if your vitamin D level is less than 30, you are at risk for quite severe complications from osteoporosis, and probably you can get soreness from statin therapy. Optimal vitamin D level said by many experts to be around 75. So getting a vitamin D level to finding where you are, and the best time to measure, as we talked about, is just after the winters or over early spring. Again, we get lots of vitamin D from sunlight, and spending 15 minutes outside, exposing your arms and your legs, and not during midday gives you 100,000 of the units of vitamin D over time. So check your level if you want to. Taking extra vitamin D, unless you're deficient, doesn't really help you at all. Sad, but I was hoping it would make a difference. It doesn't.
Yeah, so again, the question, should you be taking supplements? Well, while various nutrients like probiotics, omega-3s, zinc, vitamin D, vitamin E, these can all be associated with immune function and by extension inflammation, the results are definitely divergent in most research studies. So some will say one thing, some will say the other thing. So supplements are largely unregulated markets. So unlike the prescription medications that you might be prescribed to take, there's not the same level of regulation when it comes to supplements. So if you think there's a need for supplements, so if for whatever reason you happen to be deficient, the best thing to do is to speak with a healthcare provider. In terms of what might actually be required, vitamin D in the event that you are deficient, given that we do live in Canada where we do have winter for a substantial period of time, it is possible, and therefore you can speak with your physician about getting a vitamin D test. It is out of pocket, but you can speak with them about it in order to assess your vitamin D levels. And then calcium might also be required, especially if you kind of require excessive calcium. If you have things like osteoporosis, your risk for that is an issue. B12 and iron are the two that are recommended if you are going the more plant-based direction, especially if you are someone who menstruates. Both of these are extremely critical. B12, if you're not eating meat, you absolutely have to take, because there's very few plant-based sources of it. Unless you're happening to eat a significant amount of nutritional yeast, which is fortified with B12, you're likely not getting enough. So in short, should you be taking supplements? Probably not. If you are completely plant-based, you probably want to be taking B12. You might need to take iron, but the others are kind of up to debate.
Actually, yeah, there's really no debate. If your levels are good, you don't need them.
Yeah, true. Unless you actually have a deficiency, probably required.
Absolutely. If you're deficient, you're deficient. And most of us can get our nutrients well. I would rather get my calcium from the cocktail Mother Nature for to be healthier. As you point out, there's actually some data that if you take calcium and vitamin D, you may increase the risk of having a heart attack. Where you get naturally from food doesn't appear to have that risk. The way it's absorbed and buffered and interacted with the rest of your microbiome doesn't seem to be a problem. But just jamming down supplements is probably not in your best interest for most of us. So get your food, get good nutrition from food, and we'll learn more about whether other trials show that you can help delay Alzheimer's disease or not. Lots to learn, but usually most first little bits of information are positive, then you repeat the trials much larger, they come back negative. So lots to learn here. So certainly we'll be glad to change my mind as time goes on.
Yeah, so now that we've discussed that you don't necessarily need vitamins, let's talk about sources. So as I mentioned, vitamin B12 is primarily from animal sources. This is the one thing that if you are going plant-based, you will need to supplement. There are some products that are fortified. So some dairy products are fortified with it, some breakfast cereals, nutritional yeast, some soy products. But oftentimes the amount that they're fortified with, unless you're eating a significant serving each time, is not necessarily enough. So recent systematic reviews do show that among vegetarians, vitamin B12 deficiencies can exist throughout the duration of life. So you can have your vitamin vitamin B12 levels checked by your physician. It's there on like a standard blood requisition. But more often than not, if you are a plant-based eater, you will need to take the vitamin B12 supplement. This is probably like the only supplement that will say you absolutely need to take if you're not kind of eating animal products. So for calcium, it's crucial for bone health, and it's especially important for people who are peri or postmenopausal. Those changes in hormones can induce a lot of different changes within the body, and as a result, you really need your calcium intake. So most adults 19 to 50 years of age are required to take 1,000 milligrams of calcium per day. This is the amount that's there in 3 glasses of milk. Dairy tends to be the most abundant source of calcium, but it's not the only source. So you can also get calcium from chia seeds, soy milk, which a lot of times soy milk is also fortified, so it can be the exact same as cow's milk. Sesame seeds, tofu, and white beans are all really great sources of calcium as well. So for vitamin D, the sun is a great source of vitamin D, but there are other things that you can get vitamin D from. So egg yolks, again, egg yolks being a little bit up to debate because of cholesterol. So that can be something that you decide for yourself depending on your own health. But it's also present in fortified dairy products and fortified breakfast cereals. And again, like we mentioned, in the event you are deficient, you can get an out-of-pocket test to determine that. And if need be, you can take the vitamin D. If you are deficient in vitamin D, there is an impact in terms of inflammation, calcium absorption, etc. So depending on whether or not you're deficient, it might be indicated for you. Now, omega-3s, we talked about how these are anti-inflammatory. So it's reduced with, it's associated with a reduced risk of cardiovascular events, lower triglycerides. However, we have mentioned that taking the fish oil pills does not necessarily provide any benefits. So in terms of sources of omega-3s, where else can you get them from? The most abundant source would be fatty fish, so things like salmon, mackerel, etc. But you can also get them from some plant-based sources, so seaweed, walnuts, chia seed, flaxseed, hemp seed, edamame, and kidney beans are also sources of omega-3s. And finally, just talking about like another important nutrient, not necessarily the most related to immune function or inflammation, but potassium is really important as a nutrient to get, especially if we're looking from a lens of blood pressure control. So abundant sources of potassium include things like dried fruits, beans, lentils, potatoes, winter squash.
Beta, what are you doing, Beta?
Spinach, broccoli, avocado, bananas, cantaloupe, oranges, orange juice, tomatoes, dairy and plant milk, yogurt, cashews, almonds, chicken, or salmon are all really great sources of potassium. And finally, magnesium. Magnesium kind of has a lot of side functions in the body. It's involved with a lot of different mechanisms. So magnesium supplements in particular are not recommended because they're a laxative effect unless you have been prescribed them by a physician. But there are thankfully plenty of dietary sources of magnesium, things like poultry, nuts, seeds, leafy greens, and legumes. So in short, like Dr. Curnew mentioned, we've kind of got Mother Nature's cocktail. We've got these sources of all of these nutrients and various things that we can eat in our diet. And because we're getting them from diet, we're also getting them with their side of fiber, with their side of protein, with their side of complex carbs, etc. So it's not taking it in a concentrated format and not knowing what it's going to do to your body, but rather getting it with all of the other good benefits as well. So that kind of brings us to the question of next steps. So where do we go from here? We've kind of discussed that chronic systemic inflammation is implicated in a lot of different diseases. It can be impacted by diet. It's not necessarily something we want. So what do we do now that we know this information? So first thing is just to think about the impacts of systemic inflammation. So long-term chronic inflammation results in the body attacking its own tissues. This can lead to an increased risk of things like heart disease, cancer, diabetes. Chronic inflammation in the gut can also cause IBD. This can actually progress to go as far as ulcerative colitis, which can be quite severe. So again, though it doesn't necessarily present with symptoms right away, over time it leads to pretty severe effects. And finally, chronic low-level inflammation is also linked to cognitive decline. So it's not only something that's causative for heart disease, cancer, and diabetes, it's also involved in kind of how your gut functions, how your brain functions, etc. So chronic systemic inflammation can increase your risk for severe diseases. That's the main takeaway we want to give you today from this presentation. So how much of a role can the diet actually play? So diet is only one part of the factors that you can kind of look at to help regulate chronic systemic inflammation. So we've kind of talked about how eating more plant-based, eating more fiber, eating more of your micronutrients can help manage that inflammation, but diet's only one component. There are other factors that you can control to help manage inflammations. The biggest one is probably regular exercise. Diet and exercise kind of go hand in hand in a lot of senses. If your goal is to lose weight, they absolutely go hand in hand, but they also go hand in hand when it comes to managing inflammation. So what you put into your body is extremely important. How you use your body also extremely important. Another thing you can do to minimize inflammation is actually minimize the usage of NSAIDs. So NSAIDs are non-steroidal anti-inflammatory drugs. So yes, they're an anti-steroidal inflammatory medication. However, though, despite the fact that they're anti-inflammatory, overuse over time can actually cause some systemic inflammatory effects. The other recommendation is to limit your usage of antibiotics. So don't use them unless you're prescribed to use them, just because that kind of disrupts that microbiome within your gut, and that can also set off chronic inflammation. And lastly, the other two things are sleep hygiene and stress reduction. They're also incredibly important for managing inflammation. Sleep hygiene and stress reduction are important because if you're in chronic states of poor sleep and a lot of stress, it can kind of upregulate some of your mechanisms that can lead to inflammation. So we discussed a little bit earlier on vaccination, and today we primarily talked about diet and its role in either mitigating or preventing systemic inflammation. But vaccines are another great way to prevent this because they can protect us against diseases which are great causes of inflammation, because our body needs to mount that inflammatory response in order to get rid of the pathogen. So if we take a look at the image on the left, this is kind of speculated to be the specific and unspecific effects of vaccination on the heart. So in terms of specific effects, you get a buildup of your antibodies, you get the reduction of oxidized LDL and macrophage uptake, like we talked about in atherosclerosis pathogenesis. You get delayed plaque formation of foam cells, which means you're kind of inhibiting the progression of atherosclerosis. In terms of unspecific effects, you reduce the inflammation caused by the infection that you're inoculated or vaccinated against. And as a result, you have a diminished secretion of those pro-inflammatory mediators, which means that overall, you're causing less cardiotoxicity, less cardiac inflammation. So the image on the right kind of goes over the same things, but this time in the context of the influenza vaccination. So if you get the influenza vaccine or the flu vaccine, you get mild stimulation, there's activation of those adaptive immune mechanisms, you build all of those antibodies to help fight off the disease, and therefore you modulate the chronic inflammatory response and you kind of achieve this level of homeostasis or balance. If you get the influenza infection, there is a massive stimulation of your immune system response. And as a result, you can get an exaggerated chronic inflammatory response, and this is associated with cardiotoxicity. So though we've talked mostly about diet as the way to kind of regulate inflammation, vaccines also play an important role because they prevent unwanted inflammation from infections that you could potentially be vaccinated against. So finally, just ending off on the tone of diet again, how exactly can you evaluate your diet? So it's important to think about the things that you are eating and how you feel. So do your meals make you feel bloated, uncomfortable, lethargic? Is there something that you eat that makes you feel good? Is there a meal that particularly satisfies you? Do you eat at consistent times? Do you eat consistently? There are a variety of things that go into assessing your diet, ranging from eating habits to the actual things that you are eating. So there are two questionnaires on the slide here that I found that are kind of useful for assessing your diet. One is from the British Heart Foundation. The other one is actually from the Northwest Territories. And they kind of provide a little scoring system or an objective system for you to go through and kind of look at the things that you are doing in your diet, whether that be what you're eating, what your eating habits are like, and kind of seeing how that plays out in terms of where your diet might rank. So if you're interested in kind of taking a more objective approach in evaluating your diet, I recommend you kind of check these questionnaires out. So that kind of brings us to the end of the presentation. So just in brief summary, acute inflammation is a standard immune response to a danger. Chronic inflammation is when that inflammation persists, despite the fact that the danger is no longer there. Inflammation is involved in the development of atherosclerosis and strokes, and diet can play a role in reducing inflammation. So adequate consumption of your micronutrients, fruits and vegetables can all help reduce inflammation. Long-term chronic inflammation does increase the risk of cardiovascular disease, diabetes, cancer, a cognitive decline, etc. And reducing chronic systemic inflammation can help improve current inflammatory diseases and improve their outcomes. It can also help reduce the risk for future inflammatory diseases as well. So thank you so much for listening. That's all I have prepared for today. And as always, if you have any questions, feel free to email us.
Phenomenal. I think is that, so I think today I decreased my inflammation. I was able to try and maintain my body mass index close to 25. I'm going to go out out for a skate afterwards. Still invite anybody who wants to go. 15 minutes after her, I got to just make two quick phone calls and I'm on my way. And you can see how your diet plays a role in all this. And but it's not just diet's not good enough to prevent all illness. We have to be smart about that. So we found drug therapy such as colchicine can decrease cardiovascular events. We know that lowering blood pressure, lowering cholesterol makes a difference. If I go on a Mediterranean diet, I can lower my blood pressure, or a DASH diet can lower my blood pressure. If I go more on a plant-based eating diet, I can decrease my complications, infectious diseases, potentially in COVID and other infections. I lower my weight better. If I lose 20 or 30 pounds, in the broad trial that you showed, you can put diabetes into remission in many new type 2 diabetics, or it makes a difference. You can see how you can use all the above. And to say I'm going to lower my cholesterol with diet, it's a good thing to do that, but you can see the effect overall is quite small. Average cholesterol falls by about 5%, 10% by diet. But certainly in some people it can fall 30% or so. It's very good at lowering triglycerides. But if you know that the powerful effects of the medications are there too as well. So you want to combine the both of both worlds. You know, a year or so ago, an important clinical trial showed that getting the flu shot during flu season decreased cardiovascular events by over 25 to 30% and decreased mortality by 40%. That's not all by preventing influenza. It somehow affects your immune system by mechanisms we totally unclear. We're learning about the gut at this point in time, the microbiome. The problem is that most people think, you know, I don't eat well, I'm going to take a vitamin or supplement, and it just doesn't work. And in fact, some of the supplements, beta carotene, increases the risk of having lung cancer if you smoke. Vitamin C doesn't prevent you from complication infection. This does. And the power of vaccines has been shown over and over again. So great science. Now, how do we put this into practicalities? None of us are perfect, but I'm trying to strive to be healthier. Like always, Aditi, wonderful. You taught us all so much. Thank you again. Any questions or comments by anybody? So I was just talking to Aislinn before. She's going to go play water polo in a tube. Is that right? That sounds like a lot of fun. I'm not going to try out for the Toronto Maple Leafs, but I'm going to certainly. I'm actually good for the other team. I make other players look better all the time. I passed the wrong person, but it's a joy. Stuart, what's your takeaway from this?
Oh, thank you. I think my takeaway really is, and you talk about all the time, Dr. Curnew, is, you know, there's different pillars of medicine. There's, of course, the treatment side of it, and there's also the palliative side of it, and before that, there's the preventative side of it. And I thought Aditi did a really phenomenal job today, really just talking about the importance of trying to be a bit proactive as opposed to reactionary when it comes to inflammation and buildup of cholesterol. So Aditi talked about a number of different ways in which you can focus on preventing the buildup of inflammation so that it doesn't become an acute problem, and even worse, doesn't become a chronic problem, which can lead to cardiovascular disease or other complications. So it was a really comprehensive discussion today on medications, exercise, and diet, lifestyle changes. Other things that Dee touched upon as well is just focusing on weight management, weight reduction, getting a good night's sleep every single day can do wonders to managing inflammation. If you're smoking, working on minimizing your tobacco consumption, alcohol consumption, minimizing that, as we of course know that contributes to inflammation, is a type 1 carcinogen, which can lead to invasive cancers and cardiovascular diseases. And so for me, my takeaway is that while I'm personally not perfect either, every day you just want to try and be a little bit better and Everything is okay in moderation, but you need to focus on what's going to keep you healthy for longer. And even at this age, I'm really focused on trying to maintain a good quality of life for as long as I can, and that comes with trying to balance a bit more sleep in my life, but trying to get into a consistent exercise routine, and also trying to eat healthier every single day as well. So thank you, Aditi, for putting together a great topic and a great conversation. And thank you, Dr. Curnew, as well for your insights. I really learned a lot.
So much to be thankful for. I see Angelo is on the line there. I'm not sure if he has a comment or Aislinn, do you have a comment at all? How do you keep yourself so fit, and how do you keep yourself going?
I think I've been fortunate to have really good genetics, but I've also been involved in sport for like the majority of my life, even if they are a little bit unconventional type sports. But I think a big thing to take away too is that exercise doesn't have to be going to a gym and working out. It can be things like playing hockey with friends, or going skating, or just going for a walk with if you have a dog. That all of that sort of thing counts as exercise. The whole definition of exercise is just organized physical activity. And physical activity is basically any movement above rest. So anytime that you're moving and having fun, that's a great way to just stay active and kind of keep healthy.
Excellent, thank you. And anybody else? Any comments from anybody else?
I've also come to learn that a really good workout as well, like just as Aditi was saying, doesn't have to be overly intensive. Like today I did a workout, but I have a treadmill, and I just did something called the 12-3-30, which is you put it on an incline of 12 if your treadmill goes up to that. Put it at a speed of about 3 kilometers or 3 miles per hour, or whatever is a good brisk walk pace, and do it for about 30 minutes. And like it's surprising how much you can really work up a sweat. And it's a great way to burn fat and build leg muscles as well. I finished off my workout feeling a lot better than I did when I went onto it, and honestly, it wasn't like I was pushing myself to the limit, but it was a perfect amount of exercise for 30 minutes.
Well, I'm constantly trying to change my diet. I'm going to work on that some more. I just want to thank everybody for coming out tonight, and special thanks to Aditi, and special thanks to Connor in the background that was helping at the end put together some last minute slides. Ida, do you have a comment there?
I'm in New Delhi, India.
Oh, wow.
I missed the most of the seminar, but I thought I just checked my email and I said, oh boy, I should have gotten up a little earlier. It's 7 o'clock here in the morning.
Wow, I'm
And,
honored to have somebody from India. Wow, great.
Yeah, because I enjoy listening to the good words, and just missed it last Friday. That's when I left. But it's been wonderful.
Well, thank you so much. And I see you're moving there, so that's wonderful.
Yeah, I'm walking, doing my walk, and there's a lot of noise here.
Wonderful.
But it's nice.
Nice. And so cooking, eating, using the right combinations of diet, lifestyle changes are so important. And I'm going to bid everybody good night. And we look forward to seeing everybody a little bit healthier you.
Good night, everyone.
Good night, everybody.
Good